Welcome to Bay Area Psychology. In his book, The Shy Child, Philip Zimbardo defines shyness as a mental attitude that predisposes people to be extremely concerned about the social evaluation of others. According to Dr. Jonathan Cheek in Conquering Shyness, this includes between 80 and 96 million Americans. Perhaps you feel shy confronting a salesperson, doctor, or boss, or maybe it's just that attractive new employee at the office that sends you ducking down the hallway. Let's take a look at indicators of the intensity of your shyness from the following exercise taken from Conquering Shyness. Let's see, what I'd like you to do is, as I'm reading these, take a look and see whether this is something you disagree with, you feel like is not something you don't usually do, something you feel neutral about, you usually do, or strongly agree with. I'm tense when I'm with people I don't know well. It's difficult for me to ask others for information. I'm often uncomfortable at parties and other social functions. When in a group of people, I have trouble thinking of the right things to say. It takes me a long time to overcome my shyness in new situations. It's hard for me to act natural when I'm meeting new people. I'm nervous when speaking to someone in authority. I have doubts about my social competence. I have trouble looking someone right in the eye. I feel inhibited in social situations. I find it hard to talk to strangers. And lastly, I am more shy with members of the opposite sex. Now let's take a look at your score. If you scored over 45, then you're probably shy. 31 to 45, somewhat shy. And below 31, well, not particularly shy. Okay, so I think that gives us an opportunity to take a look at whether or not this may be an issue for us or perhaps someone that we know. I want to welcome the two doctors, Dr. Lynn Henderson, who is the clinical director of the Shyness Clinic, and Dr. Christopher Harkness. I want to welcome you as well. Thank you for joining us.
Thank you.
Okay, and I understand that you have had some recent publicity. I know I was attracted to your clinic in the article from the Mercury News talking about shyness. And I'm wondering, what's your initial take on why people would be so interested in this topic?
Probably because so many people are shy. I mean, the statistics that we gathered with the Stanford Shyness Survey showed that 40%, plus or minus 3% of the population is chronically shy, such that it poses some sort of a problem. It interferes with interpersonal life, or it interferes with professional life. And more recent statistics suggest that the figures are higher than that it's around 48.7%. So a lot of people experience shyness, and a lot of people experience some kind of interference in pursuing their goals.
Okay, so we're not talking about, you know, some of these questions would maybe be situational or momentary shyness.
Yes.
You're really treating a situation where it seems to be fairly pervasive throughout people's lives?
The way we define it is we treat people for whom it actually interferes with the goals that they want to pursue. Whether it's interfering with a job that they might want to take, or whether it's interfering with dating, those kinds of things. So it's somehow a problem for them. It's not a problem unless it's a problem.
Right, so it's kind of like traditional mental health. I know my clients, it's a problem when they say it's a problem.
Right.
Now, I know you are a therapist actually at the clinic. Do you do groups, individual kind of therapy, or how do you treat shyness?
The greater part of our treatment is a group treatment. I mean, it makes sense that a social malady would be treated in a social milieu, and the research supports that.
Okay.
So for that reason, the mainstay of our treatment is a 26-week group.
Okay.
Yeah.
And I'm wondering, I mean, it comes to mind, somebody for whom this kind of thing would be scary anyway, how do you engage people into be willingness to do group?
Well, they often call the clinic a number of times before they actually come. So we try to provide a process when they do come. Chip will answer the phone, or another of our therapists will answer the phone, and they'll explain the treatment to them, and they can talk to them any number of times before they actually come, because it's hard.
Yeah, I would think so, particularly with this population. I mean, that they, you know, when I have known people who struggle with this, it's sort of, they have a tendency to want to test the waters a little bit at a time.
Exactly.
Rather than sort of jump in.
Right, and we're open to that.
Now, are your groups males and females, or do you tend to just do women's groups, or?
Both.
We do both.
Both? Okay.
Actually, we don't do both men's and women's groups. The groups are generally, they have both in them. If we don't, and it really we put the groups together as they come in.
Okay.
So occasionally we might have an all-male or an all-female group, but it's rare, and it's often just related to when they've come in for treatment. And then we have people from outside come in and role play with the people who are practicing situations that they're scared of. So we'll choose, if it's a men's group, we'll have women come in, or if it's a women's group, we'll have men come in.
Right.
Well, what attracted you to working with this particular issue?
The longer I'm in the field, the more drawn I am to this clientele. I find it a very interesting population. And throughout my training, I've been interested in problems of inhibition, which is, of course, at the heart of shyness.
Yes, it is. What attracts you to that? Why is that interesting?
Isn't there something intriguing about people who could do something? I mean, they have the wherewithal, they in fact have the social skills in many cases, although latently, and yet they find themselves unable to do something. Partly it's so dramatic when in fact they do step out and speak with their own voice, if I can mix my metaphors.
Yeah, so you really get to see then, there's some pretty concrete change that happens with this issue.
Oh, absolutely.
Okay, and I'm sure that's very rewarding.
Absolutely, and yes, and we measure it.
One of the important things, and the thing that the clinic is founded on, is outcome data. So that we do pre-testing and post-testing so we can find out whether or not people actually have measurable changes. And that means that they'll get measurable changes in physical discomfort that goes along with shyness. We expect to see behavior change, and we also expect to see change in the particular kinds of negative thinking patterns that they get into.
Okay. That reminds me, I had taken a list of characteristics that are often associated in terms of fears of people who struggle with shyness from Philip Zimbardo's book, The Shy Child. Let's take a look. Fear of being negatively evaluated by others, fear of failure to respond in social situations, fear of being rejected by someone who is liked or controls a desired resource, or fear of intimacy. And those are all fairly broad areas, I know. But it seems to be, when I was reading this, I thought immediately of the characteristic of social phobia, actually. And I was wondering how you clinically, if you even make a difference, I don't know, between kind of that social fear of walking into a room and there's a spotlight and I'm going to make an idiot of myself versus what you're doing with shyness.
No, it's the same thing, basically, in that there's a tremendous fear of negative evaluation. The research came out of different areas. The research on shyness came out of the social psych literature and personality theory and psychology departments in the universities. The social phobia research has more come out of the psychiatric clinics. So that's one of the differences, but there's a lot of overlap in the kinds of things people experience. Did you?
Yeah, I mean, there are the terms from different kinds of discourse is all, but Dr. Henderson developed what she calls the social fitness model, which stresses a non-pathological understanding of shyness, and for that, thinking of it as being analogous to being physically fit.
So that's why I developed the social fitness model, because we just think it's better for people who come to the clinic to see this as an issue that many people probably struggle with. In fact, 93% of the population acknowledges being shy in some situation at some point in the lifespan. So we work with a social fitness model where you practice just like you do physical fitness, and not too many people are world-class physical athletes, not too many people are world-class social athletes, but most people can exercise and work out and enjoy themselves.
So yeah, you're really putting this in terms of making it a skill difficulty or a learning difficulty as opposed to some sort of trait that I'm inherently born with and so I can't change, which is a far more optimistic
and an effort difficulty.
And
it's a matter of putting in the time and effort, much as it is if you've been lounging on the couch for 15 years stuffing the chips, you need to start walking around the block and then jogging the mile.
And it always takes more effort and feels more strenuous and harder if you haven't worked out for months and months. I mean, that's what we tell people who come to the clinic. You know, if you work out for 6 months and then you stop working out, then you're not going to maintain your gains. You're going to continue to work out all your lives in one way or another. We all do.
Well, and there's that, you know, it strikes me that because of the anxiety experienced with shyness, that this would be a particular problem in the sense that it reinforces hiding.
Yes.
Absolutely.
I mean, you know, once there's an avoidant quality to it. If I'm afraid of authority, I'm going to increasingly over time do my best to not experience authority if I can do it.
And the more you avoid it, the bigger the fear gets.
That's right.
Exactly.
So part of it is kind of visualizing it instead of being this enormous thing, to kind of bring it down to manageable size. Do you use visualization? And
Well,
that sort
one of the
thing?
ways that we bring it down to manageable size is we think of it as part of the physiological patterns, the thinking patterns, the behavior patterns, and the feeling patterns, and we work with all of them. We do 12 weeks of having people just role play situations that they're scared of. But at the same time, we work with the negative thinking patterns that often go along with it, and we challenge the negative thinking patterns. We help them come up with more adaptive responses after that. Then we do communication skills training for another 10 weeks, which is trust building, active listening, self-disclosure, the kinds of things that people have trouble with in intimate situations. And then we move to assertiveness training, where people actually write scripts for situations where they need to say no. For some people who are shy, it's very hard to say no.
Yeah, I imagine that the whole issue of conflict must be something that your clients are concerned about.
Of course, because that's a matter of becoming visible, of
Right.
becoming known, and shyness is about keeping a low profile.
And do you find that people's internal sense of self is really at odds with how they're picturing themselves being seen? I know, like, for example, bulimia. I look in the mirror and my body image would be I weigh 300 pounds when somebody else might see me in a normal body weight. Is
That's
there
a good-
something similar to
That's
that?
a very good
That's a
point.
very pertinent analogy, actually, yes.
Because often they do better than they think they're doing.
Okay.
And that's why when you said a skills model, sometimes it's a skills model for some of them, but some of them are much better socially than they think they are. And as soon as they begin to practice, we start seeing all their skills emerge, and that can be pretty exciting.
Right, it's more a matter of how they're managing the internal anxiety than...
Yeah, it sounds like it, and we're going to need to take a break here, but it does sound like it's sort of an internal permission that part of your therapy creates for people, that yes, I may have the skill set, now I need to go out and actually use it in front of people.
Because,
Let's take a quick break. We will come back. Stay with